There is a technique that can lower your blood pressure within a few minutes. It requires no equipment. It costs nothing. You can do it sitting in the chair you are in right now. And there is a device based on this exact technique that has been cleared by the Food and Drug Administration and sold for hundreds of dollars. I'm going to teach you the technique for free. But I'm also going to tell you something that most videos on this subject leave out. The research on this is genuinely mixed. Some studies show clear benefit, others show almost none. I'm going to walk you through both sides because you deserve to know what you are actually getting. And near the end, I'm going to tell you about a mistake in how blood pressure gets measured that can make your number look much worse than it really is. That part might matter more than the breathing. Let me start with the physiology because once you understand it, the technique makes complete sense. Your body has an automatic pressure regulation system called the baroreflex. There are stretch sensors in the walls of your carotid arteries and your aorta. When pressure rises, they signal the brain, and the brain slows the heart and relaxes the vessels. When pressure falls, the opposite happens. It is a thermostat running constantly without your awareness. Now, here is where breathing comes in. Your blood pressure is not a flat line. It oscillates in slow waves, roughly 6 times per minute. Physiologists call these Mayer waves. And when you deliberately breathe at that same rate, roughly 6 breaths per minute, your breathing, your heart rate, and those pressure waves fall into step with one another. Researchers call that state resonance or coherence. At that frequency, the sensitivity of your baroreflex measurably increases. Your regulation system becomes more responsive. That is not mysticism. It is measurable in a laboratory, and it has been demonstrated repeatedly. So here's the technique. Sit upright in a chair, feet flat on the floor, hands resting in your lap. Breathe in through your nose for a count of 5. Then out slowly through your nose or gently pursed lips for a count of 5. That is 10 seconds per breath, which is 6 breaths per minute. Now, 2 details that matter more than people realize. First, breathe into your abdomen, not your chest. Put one hand on your stomach and one on your chest. The hand on your stomach should move. The one on your chest should stay relatively still. That means your diaphragm is doing the work. Second, do not force a deep breath. This is the mistake almost everyone makes. You are slowing your breathing down, not filling your lungs to capacity. Forcing large, deep breaths will make you lightheaded because you blow off too much carbon dioxide. Comfortable and slow, not big. 15 minutes is what the research typically uses. If 15 feels like too much, 5 is still worth doing, and 5 you will actually do. Once a day, and many people find before bed works best. If you are finding this useful, tell me in the comments whether you have ever tried counting your breaths. I read them. Now, let me give you the honest evidence, both directions. Here is the encouraging side. A meta-analysis of 8 trials of device-guided breathing found average reductions of about 3 points systolic and just over 2 points diastolic. A study in the journal Hypertension found that slow breathing at 6 cycles per minute reduced blood pressure and improved baroreflex sensitivity in people with essential hypertension. A large study using guided breathing on wearable devices found 15 minutes at 6 breaths per minute lowered blood pressure in the immediate and short term. And in 2013, the American Heart Association reviewed alternative approaches to lowering blood pressure and rated device-guided breathing as reasonable to perform. In that review, it scored better than acupuncture, and only dynamic aerobic exercise received a stronger recommendation. That is a mainstream cardiology body saying this is worth doing. Now, the other side, and I am not going to hide it from you, A later individual patient data meta-analysis applied strict quality criteria and found that device-guided breathing did not produce a beneficial treatment effect on systolic or diastolic pressure. Those authors concluded that the current best evidence does not support routine use of the device. Other reviews have rated the certainty of the evidence as low, and a controlled study found that in the longer term, device-guided slow breathing did not reduce blood pressure or sympathetic nerve activity in hypertensive patients. So, what do I actually make of that? Here is my honest read. The short-term effect is real and well demonstrated. When you breathe at 6 breaths per minute, your pressure comes down during and shortly after the session. That is not in dispute. What is genuinely unsettled is whether doing it daily produces a lasting reduction in your average pressure over months. Some trials say yes. The strictest analyses say the evidence is not there. And notice something important about the negative studies. They were mostly testing the device. The breathing itself costs you nothing, has essentially no risk, and helps with stress regardless of what it does to your 24-hour average. So my position is this: do the breathing, do not buy the machine, and do not expect it to replace anything. Which brings me to the warning. Please do not stop or reduce a blood pressure medication because you have started breathing exercises. Even in the most favorable studies, the effect was around 3 points. A typical blood pressure medication produces several times that. High blood pressure is called the silent killer precisely because you feel entirely fine while it damages your kidneys, your arteries, your eyes, and your brain. Feeling calmer is not the same as being controlled. If your pressure is well managed and you would like to try reducing a dose, that is a legitimate conversation to have with your doctor, with follow-up measurements to confirm. That is completely different from stopping quietly. Now, the measurement problem I promised, and I think this is the most practical part of this video. A great many people are told their blood pressure is high based on a reading taken incorrectly. Here is what proper technique requires. Sit quietly for 5 minutes beforehand, without talking. Feet flat on the floor, not crossed, because crossing your legs raises the reading. Back supported against a chair. Arms supported at heart level, on a table, not hanging down and not held up. The cuff on bare skin, not over a sleeve. An empty bladder, because a full one raises the number. No caffeine or smoking in the preceding half hour. And no conversation during the reading, because talking raises it measurably. Take 2 or 3 readings a minute apart and average them. Now, doing all of that wrong can inflate a reading by a surprising amount. There's also white coat hypertension, where pressure rises purely from being in a medical setting, and masked hypertension, which is the reverse and more dangerous, where readings look fine in the office but are high at home. This is why home monitoring and 24-hour ambulatory monitoring exist, and why they often change management. If you have been told your pressure is high based on one reading in a rushed appointment, ask about home monitoring. That request is completely reasonable, and your doctor will not mind. A few brief cautions on the breathing itself. If you feel dizzy or tingling in your fingers, you are breathing too deeply, not too slowly. Reduce the depth. If you have significant COPD or a lung condition, ask your doctor which breathing pattern is right for you, because pursed lip breathing is used differently in that situation. If you have a history of panic attacks, focused attention on breathing occasionally increases anxiety at first, and a guided approach with support works better. And this is a relaxation practice, not a treatment for chest pain or breathlessness. If you have new chest pressure, breathlessness at rest, or breathlessness that wakes you at night, that needs medical attention rather than a breathing exercise. 3 honest statements before I close. The immediate effect is well supported, and the long-term effect is genuinely contested. The effect size, even at its best, is modest compared with medication, exercise, and sodium reduction. And this video is education, not medical advice. I am a physician, but I am not your physician. Here is what I would tell a patient in my office. 5 to 15 minutes of slow breathing at 6 breaths per minute is one of the few things in medicine that is free, safe for nearly everyone, and pleasant to do. Even if the 24-hour blood pressure benefit turns out to be small, the stress benefit is real. And stress is not a trivial thing at 70. Just do not let it become a reason to trust a number less or a medication less. Breathe slowly, measure properly, take the pills your doctor prescribed. Those 3 things together will do more than any one of them alone. Tell me in the comments whether anyone has ever taken your blood pressure with your feet crossed and your arm hanging down. I suspect the answer is yes, and more often than it should be. Take care of yourselves, and I will see you in the next one.